Sciatica affects millions, causing pain that hinders daily activities. Characterized by pain along the sciatic nerve, it runs from the lower back through the legs. The pain can range from a mild ache to a sharp burning sensation. Simple tasks like getting out of bed or bending over can become daunting. This can lead to a decrease in the quality of life, affecting personal and professional relationships. Understanding sciatica is the first step in managing its symptoms. It is not a condition that heals overnight, but with appropriate care, it can be managed. By learning about the causes and treatments, individuals can take control of their health. Recognizing early signs and seeking timely interventions is crucial. This knowledge lays the foundation for exploring various treatment options. Sciatica often results from conditions that irritate or compress the sciatic nerve. A herniated disc in the spine is a common cause. This occurs when the soft inner core of a spinal disc pushes through its outer layer, pressing against the nerve. Spinal stenosis involves the narrowing of the spinal canal, compressing the sciatic nerve. Bone spurs or overgrowth of bone on the spine can also lead to sciatica. Prolonged sitting, particularly with poor posture, can strain the lower back and nerves. Obesity increases stress on the spine, contributing to sciatica. Diabetes can exacerbate sciatica by causing nerve damage over time. Understanding these causes is crucial in addressing the root of the problem. Identifying the cause of sciatica is essential for effective treatment. This targeted approach helps prevent future occurrences and manage pain effectively. Incorporating specific stretches and exercises can significantly alleviate sciatica pain. The piriformis stretch targets the muscle near the sciatic nerve. Sit on the floor, cross one leg over the other, and twist towards the bent knee. The knee to chest stretch reduces pressure on the nerve by elongating the lower back muscles. The cat-cow stretch, a yoga-inspired exercise, stretches and strengthens the spine. Begin on hands and knees, arching the back as you inhale, and then dropping the belly as you exhale. Regular practice can improve flexibility and reduce discomfort. Consistency is key, as regular stretching can prevent sciatica flare-ups. These exercises empower individuals to manage their pain independently. Incorporating these exercises into daily routines can lead to significant improvements. Hot and cold therapy is effective for managing sciatica pain at home. Cold therapy is useful in the initial stages of a sciatica flare-up. Applying an ice pack to the affected area for 15 minutes every hour can reduce inflammation. After the initial inflammation subsides, heat therapy can aid in pain relief. Heat therapy increases blood flow and relaxes tight muscles. Applying heat for 15 minutes every 2 to 3 hours can provide soothing relief. Alternating between hot and cold therapy can be particularly effective. The contrasting temperatures help reduce inflammation and relax muscle tension. Always wrap ice packs in a cloth and ensure heating pads are not too hot. Integrating these therapies into a pain management strategy can provide significant relief. Over-the-counter medications offer accessible and effective relief for sciatica pain. NSAIDs such as ibuprofen and naproxen reduce inflammation and alleviate pain. These medications inhibit the body's production of substances that cause inflammation. Topical analgesics like creams or gels containing menthol or capsaicin provide localized relief. These can be applied directly to the affected area, offering a targeted approach to pain relief. Overuse of NSAIDs can lead to gastrointestinal issues or kidney problems, so follow dosage recommendations. Individuals with certain medical conditions should consult a healthcare provider before starting any new medication. Combining over-the-counter medications with other home treatments can provide comprehensive relief. Using these medications wisely can help maintain daily routines and improve quality of life. Adopting certain lifestyle changes can significantly contribute to managing sciatica pain. Maintaining a healthy weight reduces strain on the spine and nerves. A balanced diet and regular exercise can help achieve and maintain a healthy weight. Avoiding prolonged periods of sitting can alleviate pressure on the sciatic nerve. Incorporating frequent breaks to stand, stretch, or walk around can improve circulation. Ergonomic chairs and workstations can help maintain good posture. Engaging in regular physical activity is beneficial for overall health and can prevent sciatica flare-ups. Low-impact exercises such as walking, swimming, or cycling can improve cardiovascular health and strengthen muscles. Implementing these lifestyle changes requires commitment but offers substantial rewards. By making these adjustments, individuals can reduce current pain and prevent future occurrences. Proper posture, supportive sleep, and regular exercise are vital in managing sciatica pain. These three elements work together to alleviate discomfort and promote overall well-being. Maintaining good posture minimizes stress on the lower back and sciatic nerve. By sitting and standing correctly, you can prevent unnecessary strain and reduce the likelihood of pain flare-ups. Quality sleep is crucial for sciatica management. A restful night allows the body to heal and recover, reducing inflammation and pain. Investing in a supportive mattress and using pillows strategically can ensure the spine remains in a neutral position. This helps to avoid pressure on the sciatic nerve, promoting better sleep quality. Regular exercise strengthens the muscles supporting the spine, reducing the risk of future sciatic episodes. Engaging in physical activities helps to build resilience and maintain spinal health. Exercise increases flexibility and improves circulation, essential for a healthy spine. Stretching and strengthening exercises can alleviate tension and enhance mobility. Activities such as swimming, yoga, and Pilates offer low-impact options that are easy on the back. These exercises provide gentle yet effective ways to stay active without exacerbating pain. Incorporating these elements into daily routines can vastly improve life quality for those with sciatica. Consistency is key to reaping the benefits of good posture, sleep, and exercise. Good posture, restful sleep, and regular physical activity form a triad of support. Together, they create a foundation for managing sciatica effectively. This holistic approach fosters a healthier lifestyle, encouraging individuals to take active roles in managing their condition. By integrating these practices, one can achieve long-term relief and improved overall health. While home treatments are effective for many, there are instances when professional medical advice is necessary. It's important to recognize the signs that indicate a more serious condition that requires a healthcare professional's expertise. If sciatica pain is severe, persistent, or accompanied by symptoms such as numbness, weakness, or loss of bladder or bowel control, consult a healthcare professional. These symptoms could indicate nerve damage or other serious conditions that need immediate attention. Physical therapy is often recommended for those whose sciatica does not improve with home treatments. A physical therapist can help design a tailored exercise program that targets the specific areas causing pain and discomfort. A physical therapist can provide a personalized exercise program to strengthen the back muscles and enhance flexibility. This not only helps in alleviating pain, but also prevents future episodes of sciatica by improving overall spinal health. In some cases, prescription medications or injections may be necessary to manage severe pain. These treatments can provide significant relief and allow patients to engage more effectively in physical therapy and other rehabilitation activities. Surgical intervention might be considered if sciatica results from a herniated disc or spinal stenosis that does not respond to conservative treatments. Surgery can relieve pressure on the nerve, providing long-term relief from pain and other symptoms. Promptly seeking professional help prevents complications and promotes faster recovery. Early intervention can make a significant difference in the outcome, reducing the risk of chronic pain and disability. It also provides peace of mind, knowing that any serious underlying issues are being addressed. Patients can feel more confident in their recovery journey with the support and guidance of healthcare professionals. Combining professional treatments with home care can offer comprehensive relief. This integrated approach ensures that all aspects of the condition are being managed effectively. This approach allows individuals to reclaim their lives from the grip of sciatica. By addressing the condition from multiple angles, patients can achieve a more complete and lasting recovery. Managing sciatica pain at home is possible with the right combination of treatments and lifestyle changes. It starts with understanding your body and recognizing the triggers that cause discomfort. By understanding the condition and its causes, individuals can take proactive steps to alleviate pain and prevent future occurrences. Knowledge empowers you to make informed decisions about your health. Stretches, exercises, hot and cold therapy, and over-the-counter medications provide accessible and effective options. Incorporating these into your daily routine can make a significant difference. Adopting lifestyle changes such as maintaining good posture, ensuring supportive sleep, and engaging in regular exercise supports long-term pain management. These habits not only help with sciatica, but also improve overall well-being. These changes address current symptoms and help prevent future flare-ups. Consistency is key to seeing lasting results. The journey to managing sciatica requires patience and consistency. Keeping a health journal can help track progress and identify what works best for you. While relief may not be immediate, the cumulative effect of these strategies can lead to significant improvements. Celebrate small victories along the way. Recognizing the signs that require professional intervention ensures that more severe symptoms are addressed promptly. Don't hesitate to seek medical advice when needed. Ultimately, the path to relief from sciatica is filled with hope and promise. Each step forward is a step towards a more comfortable and active life. With dedication and the right strategies, individuals can overcome the challenges posed by this condition, reclaiming their comfort and freedom. Embrace the journey and look forward to a brighter, pain-free future